Hi guys, today's topic is Tarlov cysts. In 2015 was when I first started getting pain in my sacroiliac region and sciatica down my right leg. I was seeing a doctor at a clinic. She did x-rays, they didn't find anything. She suggested I get an MRI, so I did that and they said they didn't find anything. I was like, okay. So at that time I was seeing a chiropractor and he was like, do you mind if I look at your MRI? Because sometimes I can see something that they missed. And I was like, yeah, sure, go for it. So I'm sitting in my chiropractor's office, and he's awesome, by the way. And he requests the stuff, and while we're waiting, he comes into the office and he's like, hey, I haven't gotten the images yet, but I got the report, and I don't know why they told you that they didn't find anything, because it clearly says on your report that you have Tarlov cysts in your sacral region. And at that time, that sounds really scary. I mean, cysts to me were terrifying, and they're in my spine. Like, what does that mean? And I was just totally stunned. And it was from that point on that I started getting all of my own reports, because after they lied to me about that, I went in and found that they had lied to me about a lot of stuff. So, separate story. But, anyways, so I eventually got to see the images of the cysts in my spine, and they look like baby bird eggs sitting in a nest. Like, that's what they look like to me. I guess they were about 1.3 centimeters each, which doesn't sound very big, I know, but they are clearly visible, and they're actually kind of big considering the size of your vertebrae and the size of your nerves, and they are just sitting in my sacral spine. Super cool. So I did research and found out what Tarlov cysts are and what symptoms they can cause, and if they could possibly be responsible for my pain. And I got referred to a specialist in Sacramento, one of very few doctors in the United States that deals with Tarlov cysts, specializes in Tarlov cysts. And that's when I really learned the most about my disorder. It's a very rare disease where basically cysts fill up on your nerves in your spine, and they're most commonly in the sacral region. I have at least 3 that we can see in there, and again, they're pretty sizable, so they can put pressure on nerves and cause issues. Without surgically treating them, there's no way to know for sure if they are causing the issues that I am experiencing. My issues that my neurosurgeon believes are related to the Tarlov cysts would include pain in the right buttock, right back. I get nerve spasms, tingling, and jolts of like electric type pain in the genital region and in the inside of my thighs sometimes. It is also considered to be responsible for my bowel issues, that it can cause constipation, diarrhea, it can cause bladder issues, it can cause nausea, painful bowel movements and bladder issues. So he's pretty sure that all of those things are due to the Tarlov cysts, but again, there's no way of really knowing unless you treat the cysts. And treating the cysts, the surgery is very intricate, I think is a good way to say it. And he basically would go in and drain the cysts and then use fat to kind of reinforce the nerves so that hopefully the cysts don't fill back up. But there's always a chance that they will. And there's no way to be sure that the issues are going to be fixed. We just know that we can treat the Tarlov cysts and go from there. So I decided not to do anything at that time, and we just said we'll keep an eye on them, and I just kind of forgot about it. And then last year, when I really started having issues with pelvic pain and the nerve spasms and the pain in my groin area was getting worse, and my neurosurgeon is completely convinced that it is the Tarlov cysts. We did a new MRI. They have gotten slightly bigger, and so he really wants to treat them. But once again, I have decided not to do that at this time because I'm dealing with so many other issues, and it basically has to become what is most important to get fixed first. And right now I'm looking at 1, 2, 3, 4 surgeries, and obviously I don't want to get a bunch of surgeries, and getting surgeries when you have Ehlers-Danlos is not the best thing to do, just because you're doing more tissue damage, and our tissues are the problem in the first place, so you're basically causing new problems. So you want to get as few surgeries as possible or put them off for as long as possible. And so I'm trying to kind of consolidate. If I can get one surgery that kind of helps multiple things, and that's what I'll do. And so right now the Tarlov cyst surgery is kind of on the back burner unless something crazy happens. But then last year I started having really bad upper back pain in my thoracic spine, so my rib area, and it's like right under my rib, like under my shoulder blades in my rib region, right up against my spine, and just really hurts in there. And again, we did x-rays and didn't find anything, but they could tell that I was in pain, and they could see that I have my shoulder issue, but I have scapular winging, so basically my shoulder blades poke out farther than they should, and it pulls on the muscles. And I also have subluxing ribs, so they knew it was an issue. So we went and did an MRI on that as well, and found more cysts in my thoracic spine. Super fun. We also found an hemangioma, and then I've got bulging discs throughout my whole spine, and yeah, a whole array of issues. But again, separate story. But as far as the cysts, I don't know exactly how many there are in my thoracic spine. I just know that they found them T7 through T11. So I don't know, it could be 3 or 4. I have no idea. But those, my neurosurgeon suggests not treating because they're relatively small, and apparently that area of the spine is a little bit more sensitive. So he would prefer not to treat those right now, and Even though I'm in pain, I'm in agreement with that because I really don't want to have to get surgery on that as well. And we don't know if they are causing the pain in my upper back. It could just be because of my right shoulder injury. So, yeah, another surgery on the back burner. So, yeah, Tarlov cysts, they're interesting. They're, like I said, super rare and kind of an unknown disease that doctors really don't know much about. There's not a whole lot of treatment for it. And most medical professionals will actually write it off. They will say that Tarlov cysts are asymptomatic, which means they don't cause you any symptoms. And that's just old learning, you know? So it's really unfortunate that people with this disorder can't get the help that they need and that there's not a whole lot to be done about it. So that's my story about Tarlov cysts. If you have questions about Tarlov cysts or you think that this might be an issue for you, you should definitely get your own reports. Because, like I said, just because you get an MRI and your doctor says, oh yeah, I came back normal, that might not be the truth. Get a copy of your reports because usually it will say that it was basically an accidental finding. It'll say incidental Tarlov cysts found at blank region, and they'll just leave it alone. That can't possibly be the reason for your pain and issues. Yes, it can. So do your due diligence, know your stuff, get your own records, and hang in there. If you want to know more, you can always comment below and I'll try to answer your questions the best that I can. I hope that you have a wonderful day and we'll talk soon. Thanks, guys.